It's estimated that between 5 to 7% of the adult population has this diagnosis, and that it's more common in females than males. Welcome back, Straight Talkers. Today I'm going to talk about somatic symptom disorder and how psychiatrists go about making this diagnosis clinically. But first, make sure you hit that subscribe button so that you can be the first to know when new content comes out. Somatic symptom disorder is listed under the section Somatic Symptom and Related Disorders in the DSM-5. Somatic symptom disorder is a diagnosis that is made when someone has physical symptoms, but medical test results are either normal or do not explain the person's history and overall presentation. It can also include symptoms that are normally bodily sensations or discomfort that people often experience. Symptoms can be specific, such as complaints of localized pain, or they can be non-specific, such as complaints of fatigue. And in children, the most common symptoms that we see are recurrent abdominal pain, headaches, fatigue, and nausea. And oftentimes, kids will only have a single prominent symptom compared to adults who typically have multiple. So the key feature of somatic symptom disorder is that symptoms lead to excessive worry and can also affect one's behaviors. Many people will repeatedly check their body for abnormalities and even avoid physical activity out of fear of damaging their body. And these patients are often seen in the primary care setting and other medical settings, but are less commonly seen in psychiatric and mental health settings. So when evaluating for somatic symptom disorder, there are 3 criteria that psychiatrists take into consideration, and these are listed from A to C in the DSM-5. Criterion A states that one or more somatic symptoms are distressing or result in significant disruption of daily life. Criterion B states that there's excessive thoughts, feelings, or behaviors related to the somatic symptoms or associated health concerns as manifested by at least one of the following. 1. Disproportionate and persistent thoughts about the seriousness of one's symptoms. Many times worry is excessive and the amount of suffering someone is experiencing is genuine and authentic. 2. Persistently high levels of anxiety about health or symptoms. What we see is that bodily symptoms and sensations are usually perceived as being really threatening and harmful, and people will often think the worst about their health even though there's very little to no evidence to support these beliefs. 3. Excessive time and energy devoted to these symptoms or health concerns. So what we see is that these health concerns can become all-consuming and can become a central role in the identity of an individual's life. And this often affects and dominates one's interactions with other people. Patients will have high levels of medical care utilization and will seek out care from multiple doctors. They're often unresponsive to various medical interventions, and some people will complain that their medical assessments and treatments are inadequate. And despite all of this, their concerns are rarely alleviated by medical professionals. When there is reassurance by doctors, it's often short-lived, and many will think that their doctors are not taking their concerns seriously. Lastly, Criterion C states that although one somatic symptom may not be continuously present, the state of being symptomatic is persistent, typically being more than 6 months. Once these 3 criteria are confirmed, the next thing I'll do is see if the patient meets criteria for the various specifiers. The first thing to specify is whether or not the patient is presenting with predominant pain, and this was formerly known as pain disorder. This specifier is for individuals whose somatic symptoms predominantly involve pain. The next thing to specify is whether or not the course of illness is persistent, and this is characterized by severe symptoms, marked impairment, and a long duration of more than 6 months. Finally, the last thing to specify is the current severity, and this ranges from mild to moderate to severe. Mild is when only one of the symptoms in Criterion B are fulfilled. Moderate is when 2 are fulfilled, and severe is when 2 or more of the symptoms are fulfilled, plus there are multiple somatic complaints, or one very severe somatic complaint. Whenever I make the diagnosis of somatic symptom disorder, I will always also screen for depression, as it is highly comorbid and can be associated with an elevated suicide risk. Now head on over to the next video to find out more ways that you can help your child live their best life.